Hello, I'm Dr. Fackrell. Welcome to Health Corner. Tonight I'm going to talk about arthritis, specifically osteoarthritis. Arthritis is one of the common reasons people come to see me because they hurt. Either in a knee, in their hip, in their elbow. There is pain involved. There are a couple different kinds of arthritis, and Jesse in a minute is going to talk about some of the different kinds, but osteoarthritis is the most common, so we're going to spend a few minutes on that. Number of treatments that can be done, and again Jesse will talk about that. One of my favorite things to do is to inject it with a steroid. A lot of times that really does help, and I enjoy doing it, so we do that frequently here. But because of the different kinds of arthritis and the other things that other possibilities that we have, it is important to get looked at if a joint hurts a lot and if it continues. Thank you.
Hello, my name is Jessie, as Dr. Fackrell mentioned. I'm a PA student, and I'll be further discussing osteoarthritis with you today. Arthritis, there are many different types of arthritis. There's rheumatoid arthritis, which usually traditionally affects younger people. It's more commonly seen in women. It's an autoimmune disease, and it's actually more inflammatory in nature than osteoarthritis. It also affects many organs of the body. There's morning stiffness that's actually lasts longer than osteoarthritis. And then there's septic arthritis. And septic arthritis usually has to do with infection. Well, it does have to do with infection of the joint. The joint becomes red, inflamed, swollen, and it's usually caused by some sort of trauma, whether it's an infection or surgery to the joint. That's when septic arthritis is most commonly seen. Another type of arthritis is psoriatic arthritis. It comes with a skin disorder called psoriasis. This is also an autoimmune disorder, and it affects many different body systems, as does rheumatoid arthritis. But today, again, we're going to be talking about osteoarthritis, which is the most common of all of those joint disorders that I mentioned. Osteoarthritis, as we said, is the most common form of arthritis in the elderly. It's also the single greatest cause for days lost from work, and is a very expensive disease. And you may think, why is it expensive? Well, you're missing days from work, you're spending money on pain relievers, and that can add up over a long period of time. So why does osteoarthritis cause so much pain? Well, this has to do with the fact that osteoarthritis is affecting the actual joint and the cartilage within the joint. The cartilage within the joint acts as a shock absorber. So you can imagine if that part of the joint is being destroyed, the shock absorbing qualities of the joint are lost. So after standing for a long time, moving around, walking, working, all those weight-bearing joints such as your knees, your hips, etc. will become affected because they're not working as well as they should. Also, your joint has the ability to be without friction when it's moving. And if you have a disease that's affecting this part of the joint, you're going to have more friction when you're moving, which then causes a little irritation, a little inflammation, and pain. The cause of osteoarthritis is actually unknown. We don't really understand how come this happens and why it happens to certain people. But we've been able to identify some risk factors that do play a part in those that go on to develop osteoarthritis later. Some of those risk factors include age. As your age increases, you're more likely to develop osteoarthritis. Weight also plays a role. Those with an increase or overweight or obese will have a greater chance of developing osteoarthritis as well, which makes sense because the more weight that's on the joint, the more likely it is to become affected. Occupation also is a risk factor. Obviously those that are working and laboring hard in hard labor jobs, or maybe are on their knees a lot or bending and moving, are going to put more pressure on maybe their knees or their hips or whatever joint they're using in their occupation daily. Joints that maybe have a history of repeated trauma or a history of an old injury are also more likely to develop osteoarthritis in the future. And family history. They have also found that family history plays a part in osteoarthritis. So, if your parents have osteoarthritis, there's a higher chance that you might go on to develop osteoarthritis as well. So, what are signs and symptoms of osteoarthritis? First, the onset is gradual or slow, and what this means is you don't just have pain all of a sudden overnight. You gradually have it, and maybe gradually it gets worse. Another thing that people notice is they have a little bit of joint inflammation. Not a ton, not a huge amount. Like if you hurt your knee or something like that, it's more minimal or small. There are no systemic symptoms, and that just means that only the joint is affected. You're not going to have problems with your eyes or problems with your stomach, maybe an irritated stomach, or anything like that that maybe are seen with other types of arthritis like rheumatoid arthritis or septic arthritis or psoriatic arthritis. Pain is relieved actually by rest and made worse with activity, which rheumatoid arthritis, for example, if you rest, sometimes that causes the joint to become more irritated and it's harder for a person to get up and move around. But with osteoarthritis, the pain is actually worst at the end of the day when somebody has been maybe up on their knees or up moving around. Maybe their hip hurts a little bit more than it did at the start of the day. Severe osteoarthritis, so when the disease progresses to become really bad, it can actually keep you up at night and keep you from functioning normally with your day-to-day activities. People who suffer from osteoarthritis describe the pain as a deep ache. Deep as in they can feel it deep within their joint. Oftentimes, as with the hip, if you have osteoarthritis in the hip, you can actually feel the pain radiate more towards the groin area. With the knees, obviously can radiate down the leg, so they can feel the pain not only in the knee but in the leg as well. Osteoarthritis can also cause stiffness. The stiffness is brief, however. It rarely lasts longer than 15 minutes. Also, some people can feel what we call crepitus. And crepitus is just a fancy word for saying that you can feel grinding or popping within the joint when you're actually moving your joint. Maybe it's in the knee or again in the hip or even the fingers and hands, which it's common to get osteoarthritis there also. X-ray findings or x-rays can be used to help diagnose osteoarthritis, and on x-rays you're actually going to be able to see a narrowing of the joint space. Is one joint affected more than another? Yes, actually one joint can be affected more than another. There also are differences in gender. So in people over 55, women are actually more common to get osteoarthritis in their PIP joints, which stands for proximal interphalangeal joint. And that is this joint of the finger, so not the very end of your finger, but the middle part of your finger. Also, the CMC joint for women is common. CMC is the carpometacarpal joint. So right here at the base of the thumb is a very common place for women over 55 to get arthritis. Men often get arthritis in their hips and their knees. So how can you be sure that osteoarthritis is your problem? Well, go to your doctor or your PA and talk to them about your signs and symptoms. They will take an x-ray, and based on your signs and symptoms, your physical examination, and your x-ray findings, you can come to the conclusion both that osteoarthritis is the problem, not one of these other arthritises that I mentioned earlier. So what are your treatment options if you have osteoarthritis? Well, at this time, there are actually no drugs that help to prevent or stop the actual process of the disease. So the goal of treatment is to help you improve with your function of daily life and help relieve or minimize the pain. The drugs that they have discovered help the best with this and are actually the cheapest are non-steroidal anti-inflammatory drugs. These include ibuprofen and Advil and Motrin and naproxen or Aleve. All of these are very common. You've seen them, they're over the counter and actually fairly cheap. With non-steroidal anti-inflammatory drugs, You have to be careful of ulcers. You can actually develop ulcers in your stomach from taking these drugs over a long period of time. And the American College of Rheumatology actually does recommend taking a proton pump inhibitor. Now you may be thinking, wow, what's that fancy drug? Well, it's another name for it is omeprazole or Prilosec. That's just a common proton pump inhibitor that helps reduce the acid in your stomach and prevent ulcers from happening when you are taking these non-steroidal anti-inflammatories. Another treatment option is actually a topical non-steroidal anti-inflammatory. So what that is, it's actually a gel that you put on your skin instead of a pill that you take. You can put it right on the inflamed joint. It's called diclofenac, and there are others out there. This is approved by the FDA for treatment of osteoarthritis. You apply it again to the affected joint 4 times a day, and it's shown to be more effective than placebos specifically for knee and hand arthritis. Another topical cream that can be used is topical capsaicin cream, which again you put on your affected joint 4 times a day, and it also is shown to prevent or help relieve pain in that affected joint. Another treatment option, and another conservative treatment option, is actually joint injection. So you can inject the joint with a corticosteroid, which is a really powerful anti-inflammatory medication. You can actually take a needle and inject the joint, whatever it is. You can do this 3 to 4 times a year. And if you do any more than that, the studies have shown that it will break down or cause damage to the joint and the tissues and the cartilage within the joint. Finally, when your osteoarthritis becomes very severe, so you have pain at night, pain that is not relieved by rest, and your daily activities are becoming really affected by this osteoarthritis, surgery may be an option that you might consider. With surgery, you can actually do what we call a total joint replacement. They do this with shoulders, or with knees, or with hips. And for this, you'll need an orthopedic surgery consult, which you can talk to your doctor about that for a referral. You may be thinking, are these the only options that I have? There's got to be more options. Well, you're right, there are more options. And they don't have to do with surgery, and they don't have to do with drugs or joint injections. The first one is weight loss. The studies have actually proven that weight loss can both decrease the symptoms and the pain of osteoarthritis, as well as maybe reduce the progression of osteoarthritis. And the studies, they looked at specifically the knee. So this may be something to consider and keep trying to do. Along with weight loss, physical therapy and exercise programs can help improve your symptoms of osteoarthritis. This is because when you increase the muscle mass, you're actually helping to take the load off of the joint. What are some more things that you can do? Well, I know my dad has arthritis in his knees really bad. And he always tells me, oh, I don't want to go run, it hurts my knees, I don't even hardly want to go walk, I'll do it, I'll tough it out. Well, another thing you can do is non-weight-bearing exercises. This includes riding a bike, riding a stationary bike, or a moving bike. Or you can swim. Swimming is a great way to get the weight off your joints and to be able to exercise also and help build up those muscles to, again, help improve those symptoms of osteoarthritis. You may have to use a cane for a while. There's nothing wrong with that. If a cane is used on the opposite side of whatever joint is having problems, it can actually take the load or take some of the weight off that joint and may help you not be in so much pain. Cushioned shoes also may help, so make sure you're looking at your shoes and that they are cushioned and really supportive. And finally, I would like to include a picture. This picture shows the different spots on the body where osteoarthritis is more common and where rheumatoid arthritis is actually more common. There are differences in the disease. Rheumatoid does like to affect specific joints that maybe osteoarthritis doesn't really affect. This concludes our talk about osteoarthritis tonight. Hopefully this video has been helpful to you. in determining what maybe if you do have osteoarthritis. If you have any further questions or symptoms maybe that you're concerned about, please feel free to contact your primary care physician and they will be able to help you.